Hello, I'm Dr. Chelutrenya Melokwe, a lawyer specializing in health law and ethics and an advisor to Resolve to Save Lives, an initiative of Vital Strategies. In Nigeria, where I focus my work, and around the world, we've seen the crucial difference that law can make in our response to the COVID-19 pandemic. By improving our laws, policymakers and thought leaders like you have the power to strengthen our response to this unprecedented emergency and potentially prevent the next one. How well your country responds to emergencies like COVID-19 rests on the strength, clarity, and flexibility of your country's laws. After reviewing legal frameworks from all around the world, we've found 12 characteristics that distinguish the most effective laws. Consider carefully these 12 characteristics and how you can tailor them to your country and your legal system. Effective laws address the complete life cycle of emergencies. The legal framework should apply before, during, and after an emergency to prevent, detect, respond to, and recover from it. The law should allow public health activities to adapt and adjust to the levels of phases of an emergency. Once the emergency has settled down, there should be a formal review of lessons learned. Our laws need to clearly define the range of events that can trigger a public health emergency. The list must be broader than just infectious diseases and include famine, chemical, radiation, and foodborne illnesses, among others. Any list should also provide a catch-all provision for novel events and any public health emergency of international concern declared by the WHO. Not every infectious disease should be listed, and public health authorities can address infectious diseases without triggering an emergency. Effective emergency response requires a clear and quick action by public health authorities without unnecessary red tape. The law should therefore streamline the decision-making process without sacrificing meaningful oversight. There should also be clear criteria for who can declare a public health emergency, under what conditions, how long the temporary emergency measures can remain in place. Funding, very important. Government budget allocation should cover the normal operating expenses for an emergency. Additional emergency funding sources and expedited disbursement mechanisms should also be established to cover extreme or unanticipated events. Authorities need power to implement a broad array of public health and social measures to respond to unexpected challenges in an emergency, like quarantine or isolation, hygiene or distancing rules, contact tracing and investigative procedures, as well as testing, treatment, or vaccination standards. National laws must satisfy the country's commitments under WHO's international health regulations. These obligations include maintaining core capacities, designating points of entry, providing appropriate services to international travelers, establishing and empowering a national focal point, and reporting to the WHO and other countries. Government's responsibility to respect the fundamental rights of its people is even more important in an emergency. Restrictions should be the least intrusive needed to achieve the health objective. Without discrimination, all people must have access to basic needs such as food, water, shelter, and medical supplies. Anyone who has legitimate complaints should have access to a meaningful appeal process. New emergency provisions should augment operational health strategies. You need to ensure the continuity of essential health services during an emergency. Existing coordination channels across sectors and agencies should be maintained, whether through One Health or integrated disease surveillance and response or other strategies. Public health authorities need timely and accurate data to allow real-time operations and decision-making. Any law should regulate access to health data and balance privacy, confidentiality, and data protection against transparency principles. Effective public health emergency laws empower health agencies to provide wraparound protections for healthcare and other essential workers, including hazard pay and benefits, enhanced insurance and liability protections, guaranteed PPE and workplace safety measures, guidance on crisis standards of care, amongst others. Authorities must also protect workers from community attacks driven by fear, stigma, or misinformation. Next, we need to make sure the rules are enforced effectively without imposing unjust penalties. Public education, risk communication, service delivery, and enhanced monitoring must be prioritized. In extreme cases, deterrents such as fines, license suspension may be required as a last resort to protect individuals and communities. The Public Health Agency should lead coordination and training of enforcement across all sectors. Finally, transparency. Governments must provide the public with consistent and constant access to factual information through risk communication. Any law should encourage utmost transparency throughout the emergency. This commitment to transparency should extend even to whistleblowers who speak outside of approved government channels. These 12 touchstones can help you design a strong legal framework to protect and promote public health during an emergency. Did you find all these elements in your current laws? If not, which of these best practices can you integrate? We hope this short video helps you reflect on how laws can make our response to public emergencies more effective. Many countries are taking steps to apply these best practices. With your leadership, we can enact and implement these life-saving policies today. Visit preventepidemics.org to download guidance documents that will take you through the 12 characteristics and other COVID-19 resources in depth. Share this video and resources with your team and colleagues, or email us with additional questions. Will you join us? We're looking forward to hearing from you. Thank you.